morning. I just sent the handout to the email my so you have the handout of my lecture today. Everybody in the online is okay. And we'll start the video and share. Okay. Let's start the lecture about the drugs for common oral lesion treatment. Okay. So you all you have the handout. Okay. So it's very easy one of the lecture because it's just to introduce the drug that used in the common oral lesions. I emphasize the common oral lesions because of the severe oral lesions should not treatment by the GP like you. It should be treated by the specialist, just the oral medicine doctor. So I will lecture you about only the common drug use. Okay. And these are the reference that you can search for the more information. So it's not the update, right? It's the hidden list, so you can search for more update about the second one is very important because it's outlined from the American Academy of Oral Medicine. So it's choose in this guideline is information use the update drugs and it show the how to use, how to select the drugs. So it's very important. And this for high information about drug use in the oral cavity or drug use in the dentistry. So this is the analyzed book is an update book for the drug use in dentistry. So in this guideline show you the drug use for the treatment oral medicine, treatment for periodontal disease, for the oral surgeries, and it's involved about the prophylaxis of antibiotic for use in our fields. So this is the list of oral mucosal, I will emphasize the mucosal lesions in oral cavity. So all of you not just the preclinic one, so you see the patients. So I would like to ask you about the experience, your own experience. So anybody you have the problem in the oral regions? Herpes, in Thai is lerm, right? อาจารย์ maybe อาจารย์วรานันท์อาจารย์นฤมลอาจารย์นิดเดียวจะ lecture you about the lesions. So you have any problem in this?
Maybe have cracked lips on back
Cracked lip, not the cheilitis, not cheilitis, right? Just cracked lip.
ไม่ใช่ปากแตกธรรมดาครับ
Okay. So what your treatment about the cracked lip?
เด็กบ้อง
Lip balm. Okay. Okay, about you? เหมือนกัน ช่างหนูไม่ชื่ออะไรเนี่ย So you have any problem about the oral lesions? Candidiasis? No. Herpes. Simple infection in oral cavity. Herpes labialis. Aptar ulcer. Aptar ulcers, right? You have somebody in here. You have the problem about an aptar ulcer.
ร้อนไหน
Sometimes, how you treat yourself by yourself?
drink a lot of water
Huh? Drinking water? Only drinking water? Okay, that heal by itself, right? So, how long that your healing? Means you did more than 1 week? No. Okay. If more than 1 week, you should apply kind of drug, not only the drinking more water. So anybody? Just after also. So you have, I think you know about the type of the Aptar ulcers. What type of the Aptar ulcer of you? Major Aptar ulcer, minor Aptar ulcer, hepatic Aptar ulcer? Why do you think it's maybe minor Aptar ulcer? Not too false. Just explanation about your lesions. Okay. I think you just back to learn about the kind of the lesions in the oral cavity. So this is a list. Some is common, just like herpes simplex, and recurrent Aptar ulcer or recurrent Aptar stomatitis, candidiasis, cheilitis is very common, right? Geographic tunnel treatment is just occur in your tongue, but not necessary to treatment. Xerostomia, or maybe you advise your patient to drink more water or sip the ice. Lichen planus is not common oral lesion for the GP. So you refer if you help the patient with the lichen planus. Pemphigus or MMP is very seriously, because not only the lesion in the oral cavity, maybe the lesion in many important organs, just like the eye, so you refer. Also, the oral erythema multiforme should refer. They just saw now you can treat it. Burning mouth syndrome is very difficult to diagnose, so maybe sometimes you don't know that the burning mouth syndrome. So maybe you try to treat, but because the successful for treatment, you choose refer. Right? Gingival enlargement, maybe periodontitis, can treat it. But sometimes the reasons from the drug used for the gingival enlargement, so maybe you refer to the physicians to change the drug for the treatment. And okay, this. Okay. Next. It's very important that you should know before the treatment is some conditions, and many conditions will say that no cure. So it's just for relieve discomfort, to minimize recurrence or the shorten critical the duration and efficacy. just like oral lichen planus. Lichen planus, I will lecture later. No cure. The dentist prescribed that for many times, so it's disappear, recurrent, so you should try again. And it's very important that you should accurate diagnosis. I will say that for the example, my friends, when we study at the Chulalongkorn, her nephew has some problem about the lesions on the lower lip. So many lesions. So I can say, so many ulcer, more than 10 ulcer at the labia. So just I and my friend so young. I don't know. I just think that is the aphthous ulcer. So aphthous ulcer very easy for us. My ajahn lecture that you just prescribe the triamcinolone acetonide to apply to the oral lesions, right? So she prescribed the triam apply to her nephew, and the next day, what do you think? What happened to her nephew?
It got worse.
Yeah, right. So many ulcer in oral cavity. So I think she shocked and realized that this is a wrong diagnosis. What is the accuracy diagnosis? What would you think?
Is it herpes labialis?
Right. Herpes labialis. So we changed the drug, right, and successful. So I think that the diagnosis is very important between us viral infections, bacterial infection, autoimmune disorder. So you choose I think pull the data of the clinical appearance, pull the data about the history of the history of the disease, and the history the previous treatment of the lesions, and that can improve your treatment. Okay, the next is just I said that you should determine the diagnosis before treatment. You should exclude the infection, exclude the malignant or cancer, and if you don't know and you try to treatment, maybe sometime maybe you prescribe some kind of the drug such as the anti-fungal before you know what is it. Right. So it's a trial, therapeutic trial, that's the basis. And in our field, in the oral medicines, the biopsy is very important and recommend for the differential diagnosis, such as between lichen planus, MMP, Pemphigus vulgaris. So it's very important to differential diagnosis. But however, it's the same treatment, right? Huh? Okay. But okay, as I said, that is it's just different. So for the treatment for you, the GP, the treatment we have the two interventions about the topical intervention and systemic interventions. So how can we decide to the use between that intervention? So this is the considerations. So we consider about the characteristic of the oral lesions, the extent, the severity, and locations. For the example, if your patient have many oral lesions, multiple oral lesions in the cavity, so the systemic intervention is the first choice for the treatment, because the topical you cannot apply the topical to the every region in oral cavity. But sometimes Sometimes the preparations of the drugs such as the Maulings can help you because it can cause every oral mucosa in the oral cavity. Maybe you can use the topical intervention such as the Maulings, but you cannot apply the ointment, gel, or the cream to the lesions extend in all over the cavity. Okay. And this is I will recommend you to consultation for the oral pathologist, oral medicine doctor, oral surgeon, and physician in some case that severe and you I think not supposed to be. And what is it? What is it? Not your experience, so you can refer and consult Ajahn in this field. Okay, I will step by step in the lesions. The first is recurrent after stomatitis. So you can see the lesions. And before the treatment, you should know about it. So you know that is the immune response or the autoimmune disease, right? And many factors that emphasize this lesion, such as the stress, trauma, allergy, and endocrine alterations. When the girl have the menstruation, maybe the abscess ulcer can occur between the menstruation cycles. And some kind of the food, just as the gluten. Gluten is in the I don't know say in the some kind of the drug, such as the ของหมัก I should say that can the factor that can cause the abscess ulcers. So why I said that, because the successful of the treatment, you should exclude this predisposing factor, can help in instruction to your patient, can help the treatment successfully. So okay. So this is a review for the type of the abscess ulcer. Okay. Somebody left the meeting.
อาจารย์หลุด
อาจารย์หลุดเหรอ
ไม่ครับหมายถึงว่าเพื่อนอาจจะแบบเน็ตไม่ดีอะไรจะเชื่อมมาอะไร
โอ
เงี้ย
เค โอเค โอเค So you look in this, I will say that the minor abscess ulcer usually occur on non-keratinized oral mucosa. Maybe this is a key for you for the treatment. Differential diagnosis about the ulcer of the herpes simplex virus, because the herpes simplex virus usually occur on the keratinized gingiva. So if you can see, sometimes I can see the ulcer, multiple ulcer on the gingiva or the apex gingivas. So I know that it's not the abscess ulcer. It's maybe the ulcer from the viral infections. Okay, it's painful, small shower, so it's the same. And this is a major abscess ulcer, so it's the size of the ulcer is bigger, more than the 1 centimeter. Very painful, abscess ulcer very painful. Maybe sometimes the abscess lasts for week or month, so it's suffering for your patient. So in this case, you prescribe the drugs. and you should know that maybe some ulcer of the malignant have the same appearance, just look like the MCAS ulcer. So you should differentiate diagnosis that kind of an ulcer. Okay. That is the third. The third one is the herpetic form ulcer. Okay. So this I will show you. What is this? What kind of the MCAS ulcer?
Is it major?
Maybe this is less than 5 millimeter.
Minor.
You can compare with the tooth size of the tooth. So this is a minor MCAS ulcers. This is a major MCAS ulcers. This is a minor MCAS ulcer. This is a herpetic form of MCAS ulcer. Okay, the treatment. This is I will show you the rationale for the treatment. So many kind of the drug. You can see the barrier, because maybe the barrier can coat over the lesions. It can help to treatment, because the minor MCAS ulcer is can heal within the 7 days. So just not the drugs, right? Just coating for prevention about the drinking, eating. And the second one, the Amlexanov is not available in Thailand, but available in America. So some paper that you can read, maybe you can see the Amlexanov. So you should know that the treatment for the MCAS ulcers. And topical systemic corticosteroid is available in Thailand, so I will show you later. And some immunosuppressant can use, but I not recommend the GP for use the immunosuppressant for treatment, and maybe combination about the list. So the successful of the treatment is you should initiate as early in the course of the lesion as possible. So maybe sometimes you advise your patient that have the history of the MCAS ulcer. Maybe you prescribe some of topical steroid for her for prophylaxis. If your patient have the problem, your instruction that the patient can try by herself as early as she feels. And this I said now. So this the example, just example of the prescriptions. This is for Amlexanox. So you can see I will show you the concentration of the drug. When you prescribe the drug, not only the name of the drug, you should write the concentration of the drug and the preparation and how to treat. And for the Amlexanov, you drop on the affect area 4 times a day until heal. What the 4 times? 4 times is you should apply before or after meal? After meal. Okay. You should apply 3 times after meal and before bed. So it means 3 times a day. This is the example of the barrier that you can buy from the counter of the pharmacies. And this is recommend that if you think that your patient maybe so in severe case more than 2 weeks, you should apply the antifungal for in combination with the steroid, because the steroid can immunosuppressant and is the imbalance the oral flora in the whole cavity, so the fungal may be infections. So you should apply the antifungal with the steroid. And you should think about if you are prescribed the drug more than 2 weeks about the corticosteroids, it may be result atrophy on the mucosa of your patients. What happened? The mucosa is atrophy. This means that the drug can increase the potential to absorption in the oral cavity. So maybe sometimes over of drugs for the patients, and you should be careful. So it's a common the drug that you should prescribe for treatment for the patient have the problem about the ataxia. The dry eye syndrome is the first dry eye. So it's you don't think this is the name of chemical. So in some countries it changed. In Thailand, there's a triamcinolone acetonide, it's the same thing. This is a trade name, but Kenalog is not available now. But maybe it's the other name of the drug. And this is a preparation of the triamcinolone. Maybe you should write triamcinolone acetonide in oral base in the oral gel, so they are different. And this concentration you should prescribe 0.1%. And so it's the same coated in film after each meal. So in many patients they report the problem about the method to apply the drug to the lesion. Some doctors, some dentists instruction about the use of the cotton bud. So cotton bud, you have the two ends, right? One end maybe you wrap for before to try the drug in the other end. So just wrap, not rub, because the rub maybe the patient the have the problem about the lesions. Maybe the rub can increase the ulcer. Maybe patient have the pain during the application. So just that for the lesions. And you should emphasize your patient that after apply the drug, about 5 minutes or 10 minutes after apply, do not drink, do not speaking, do not eat any kind of the food. So let the drug contact to the lesions more than 5 to 10 minutes that the drug can effective. Okay. And this is the list of the topical steroid available in the market. So you can see outer, potent, intermediate, and low. I will compare the potency of the steroid with the hydrocortisone. This is the natural steroid in the body. So you can see the triamcinolone. The triamcinolone acetonide is the intermediate, and dexamethasone is a potent, and clobetasone propionate is other potent. It is available in the market now. Clobetasone, dexamethasone, fluocinolone acetonide is available in Thailand. It is not available in Thailand. Okay. So first step for the GP, use only triamcinolone acetonide. in expert, maybe they will start with fluorouracil, etc., but not GP, right? So if you try to treat dry the first, and then if not effective, you try with fluorouracil or refer to the oral medicine dentist. Okay, this is another one I recommend you to try. This dexamethasone. So this preparation is the elixir. Decadon is available in America, but not in Thailand. In Thailand, we have dexamethasone gel. It's not this is a for preparation for the mornings, right? So we should use the links. Teaspoon is mean 5 millimeter, right? For 2 minutes. So you should emphasize your patient 2 minutes, because 2 minutes is so long for your patients. So 4 times and expectorated. Okay. But if the dexamethasone gel, just same instruction with the triamcinolone, apply to the lesion 3 times after meal and before meal. So prophylactic antifungal therapy should initiate in patient with history of fungal infections with prior steroid administrations. Okay. And for severe case, I will skip it because this is in severe case, some dentists prescribe the prednisolone. We have 2 regimens of the prednisolone, but I show only two recommend. But some doctor, my friends at Sela, prescribe prednisolone 5 milligram, 2 tablets, 3 times a day. Right, not more than for 5 days. But in this 2 is used only in the morning. So I think it's the art and science for treatment. So this for the specialists, okay. So I not emphasize for this, but just know, right? So next, the oral care planners. So what do you know about the lichen planus? บอกไปแล้ว 1 นะรู้ไหมอะไรมี Okay, what do you know about the kind of the lichen planus? The type?
Oh, there are many types. But then, lichen planus in general, it must have a become stripe. So like lacing white.
Right, striation.
So, and I think there are like 4 different forms of it,
Right.
being like there's like
Striations, atrophy, erosive.
erosive.
Okay, you know about the Raynaud reaction?
ครับ
So it's very important about the lichen planus. You should differentiate diagnosis about the lichen planus and the Raynaud duct reactions, Raynaud contact, right? Because the treatment difference, right? So it's very important to clinical examinations and taking the history of the lesions. So if your patient have the history of the use some kind of the drug that can cause the lichen planus, so we can call the Raynaud drug reaction. So the treatment, the first is to change the drug, right? And maybe you can apply the steroid and treat that. But in some case of Raynaud contact, you should change you should change the dental material. You should change the maybe amalgam to the composite lacing fillings, and it can help to treatment before start with the drugs, right? And so let me show you the photo of the lesions. So this you should know the etiology of the lichen planus. It's an autoimmune disease, and so many factors can increase the disease, and you should about the cause this. So this is a kind of white striation of the lichen planus, and this the erosive type of like I would say that erosive lichenoid regions, because the history of this patient have a problem about the rheumatoid arthritis and takes a steroid or maybe some kind of the drug to treat the rheumatoid arthritis, such as I have a problem about the rheumatoid arthritis. I start with the steroid anti-inflammation NSAID and some with methotrexate or some kind the other of kind of product that can cause this kind of lesions. So you can see lichenoid oscillations. The first time I see this picture, they said that maybe she has a problem about the cancers, but we can see the striation on the tongue. So we think about the lichenoid drug reactions. And there's the ulcers. The first time I think about the lichenoid contact, right? You have some kind of the dental material next to the lesions, and there's the dental material next to the lesions. But however, this patient have a problem about the gout and take the allopurinol. The allopurinol is very dangerous. So I think dangerous drug that can cause many kind of the drug reaction. The side effect on the oral lesion, and so you can see that this is a lichenoid drug reaction, okay? And the treatment, no curative, so you should provide the drug for comfort the patients, okay? So this is, you can choose in this severe case, maybe some doctor apply two type of the drug, anti-inflammatory and immunosuppressant drugs, and plus with the systemic antifungal agent, right? Because the treatment more than 2 weeks. Okay, this is for the example to treatment lichen planus. It's not severe. You can start with the fluorouracil acetonide, not start with the triamcinolone acetonide. So apply with the topical steroid with fluorouracil acetonide in Thailand, gel coat, just the same with the instruction lines, just the same with the Atlas ulcer. Or maybe you can use the dexamethasone links. And the prophylaxis antifungal therapy should do it. For severe case, we use the dexamethasone elixir or the dexamethasone link. This is concentrations. As I said, Decadon is not available in Thailand. Dexamethasone elixir not available in Thailand, but we apply to dissolve the dexamethasone to the water. and instruction the patient to link just like mouth links or mouthwash.
ใช่ครับคือโซเหมือนไม่มีที่เป็นเมารินขายแต่เราก็เลยต้องผสมเองอย่างเงี้ยเหรอ
Right. In fresh preparation, in hospital preparations.
อ๋อคือเราผสมให้คนไข้ใช่ไหมครับไม่ใช่คนไข้ผสมเองใช่ไหมครับ
The patient mix by herself or by himself. For us,
อ๋อ
you fresh preparation.
ครับ
At this time, we washing to mix. But I will not show you the mix. the how to mix that. But then the last week I talked about my friend, the doctor, at Sierra Hospital. He not recommend to use it like that because we don't know the outer components in the capsule of the dexamethasone. That may be interaction with the oral cavity or may something effect. But we don't know that the dexamethasone that we mix fresh preparation can absorb to the lesions and effect or not. But in the real world, we know that in our field we know that some patient that effective, but some patient not effective. But we try to use the dexamethasone that the high potency more than the fluocinolone acetonide to use. And in some cases, so in the other hand, we prescribe the prednisolone for the patients. Right? But sometimes we mix topical and systemic together. So prescribe dexamethasone links with the prednisolone to the patients. So many factors that you consider because for the severity, extent, just like I said before, and I don't know just to say, it's very difficult to consider. It's not expert, but even in the expert, can you decide to choose to use only one, to use a combination with the same type of the drug, just a steroid. But sometimes the combination with the anti-inflammatory drug with the steroid. So it's the art. Okay. This is a prednisolone, right? Oh. This is very dangerous. Tacrolimus. Tacrolimus is the suppressant. No. It's a immunosuppressant. The doctor prescribed this in general, but I think it's very dangerous for the dentist to prescribe this. So many side effects that occur. In some cases, apply the tacrolimus ointment, so you can see less concentration to the effect area two times a day. But it's the option in for expert. Right? Okay. The next is candidiasis. I think candidiasis is very easy for us. So you can know the cause is a candidiasis albicans, and so you know that if you suppress the bacteria, so the imbalance in the oral mucosa in the cavity can increase the proliferations of the Candida albicans. So if you use the broad spectrum antibiotic steroids, so medicine that can reduce the secretions of cytotoxic agent can cause the Candida albicans the Candida infection is a low locality, and this condition that can contribute to the candidiasis. Right. So xylostomia, EM, poor hygiene, hypothermic, just like use the APD that cause the oral candidiasis, and some kind of the patient that has the systemic disease such as the AIDS can cause the candidiasis. Okay, so this is candidiasis not in general. It's in the HIV patient, so you can see many of the candida in the soft palate, and this can occur. In general, you can see the third light at the lateral of the tongues, and this is not easy to diagnose because the first time I can see a diagnosis is the dental stomatitis, right? But it's more than dental stomatitis. It's the dental stomatitis plus candidiasis. So you can see layer erythematous on the cover under the dentures. So there's a fungal infection. So you should apply the nystatin or fluconazole to the lesions. So there's I think there's the mind, the fungal. You can see this. Okay. So the regimen for treatment. So you re-establish the normal balance, the oral cavity to improve oral hygiene. So medication. So the it's very important. If the lesion disappear in the oral cavity, maybe sometimes patient think that it's okay now. So she or he do not use the mouthings of the antifungal, so it's not good for her because maybe the candidiasis will immediately commence. So you should emphasize your patient that if the medication should be continued for 2 days after clinical signs has disappeared. So you should emphasize your patient to use 2 days after the lesion that disappeared, right? So this is an example of the antifungal to treatment in the topical. We use the nystatin oral suspensions. So the concentration is 10,000. Yeah. 10,000, 100,000. So we take. So you can see 2 to 5 milliliters. So it's the nystatin is very expensive. So advise to use only the 2 milliliter, 4 times a day, links 2 minutes, and so okay. This is an ointment to coat inner surface. Coat inner surface of denture, coat to the oral lesion on the oral mucosas. So it's mean after meal 3 times a day and before bedtime. So maybe powder on the denture. So in some cases that severe, maybe we dentist prescribe vaginal suppository to use. So you should instruction that why we use this because it's a sustained release in the oral cavity. So use 3 times a day. And do not leave 40 minutes after use this. Okay, this is for the example. Tritomazole, Miconazole, maybe sometimes we use vaginal cream. eh? So that's for the example. Okay, maybe we use combination of the many preparation or antifungal. Okay, sesame is a fluconazole or fluconazole. So you can read by yourself, right? Okay. So the last one, so I have the 5 minutes about the herpes simplex. So you should know about the appearance of the herpes simplex infections. Mhm. So just let you know for the treatment for relief symptom, right? So if the patient has the ulcer, so you should not necessary to treatment, right? Mhm. Because the antiviral drug is not effective for that. Okay, support maybe with supportive therapy. Okay, systemic cyclovir for treatment in immunocompromised patients. You know the immunocompromised patients? Okay, just as a HIV patients. Okay, maybe topical steroid should be avoided just for the example that I told you before this. And patient should be cautioned avoid to touching herpetic lesion to the other organ, just eye, genital organ. So we should emphasize that. So the drug that used for the herpetic infection is for relieve the pain. If you have pain, you prescribe this. Maybe anesthetic apply to the lesions. And this acyclovir for treatment, for relief. So, okay. Natural supplement, maybe in Thailand, I think it is available. Ensure Plus. Ensure is available. Maybe you can prescribe this. Drink for improve the health of the patients. Okay. If you have some pain, you prescribe the analgesic. The easy one is the paracetamol. So for severe case, maybe you plus the paracetamol with the codeine. So Tylenol number 3 is okay. I can try it. And use twice is okay. Okay. So the recurrent actors. Sorry to skip it. Okay. Prevention. Usual prevention if you have the history that some lip. Okay. We should use the antiviral cream. To minimize for recurrent access. Okay, you can call, or maybe you can advise to to patient apply by themselves with the ice on the areas during the prodromal phase. You know the prodromal phase? You don't know about the prodrome? Really? So the patient have with the before the have the lesion, but or vesicle you know that the herpes simplex start with the vesicle, but before that, patient have the predermal phase, just like she has some problem of maybe have the fever, have some feeling about the ใช่ชุดยิบรู้สึกยิบบริเวณที่จะเป็น so it's a normal phase. So you can ask, so patient have the fever. Later, if your patient report that have the fever before the vesicle or before the ulcer, because maybe some patient don't know the vesicle, they have the vesicle, so that the predor. So you can advise for prophylaxis about this. You use the ice, right, at the predor phase, maybe abort the lesions. Okay, just warsaiphovir. So that all my lecture was I'm so sorry for your lab. So any question?
อาจารย์เน้นให้แบบจำโดสแล้วก็เปอร์เซ็นต์อะไรอย่างเงี้ย
คือเจอโรคประมาณไหนแล้วก็ต้องให้ยาตัวไหนแล้วก็ concentration เท่าไหร่อะไรอย่างนี้คือ
นี่คือ
อาจารย์คือที่อาจารย์อยากให้รู้ใช่ไหม
ใช่ถูกนะคะเพราะฉะนั้นก็จะอีซี่สำหรับข้อสอบของอาจารย์มากไม่ต้องคิดอะไรเยอะนะคะข้อสอบจะแก้ไขง่ายๆก็อาจจะมีอาการให้เห็นประวัติรูปร่างหน้าตาประวัติให้เห็นหมอต้อง prescribe drug ให้อาจารย์ความหมายในการ prescribe drug คนในห้องจะได้ยินคนในนั้นจะได้ยินไหม
อาจารย์น่าจะต้องพูดใส่ไมค์ครับ
Sorry อาจารย์พูดไทยเพื่อจะบอกข้อสอบให้หมอจะตอบอาจารย์ได้ถูกใจอาจารย์นะคะ ก็คือข้อสอบของอาจารย์นั้นคงจะบอกโรคขึ้นมาให้หมอเนี่ยก็คือไม่บอกได้ diagnosis โรคบอกสิ่งที่เห็นบอกประวัติที่เป็นนะคะเพราะฉะนั้นหมอจะต้องตัดสินใจเลือกยาที่จะรักษาให้อาจารย์ได้ถูกต้องนะคะเพราะฉะนั้นยาที่ให้จะรักษาก็คือเวลาหมอจะเขียนใบสั่งก็คือจะต้องเขียนใบสั่งยาเลือกยามาแล้วเขียนใบสั่งยาให้เป็นเพราะฉะนั้นหมอก็ไปดูในตัวอย่างที่อาจารย์ให้นั่นแหละนะคะแล้วก็ลองเขียนมาเพราะฉะนั้นสิ่งที่ควรจะเขียนก็คือมาละชื่อยา concentration ของยาถูกไหมใช้ยามากแค่ไหนแล้วก็ apply ยังไงก็เขียนมาให้ชัดเจนแค่นั้นหมอก็ได้คะแนนของอาจารย์แล้วนะคะไปแล้วนะอาจารย์บอลมาแล้วอะไรนะลูกเขียนข้อเดียว
อาจารย์ให้ข้อเดียวเหรอครับ
ไม่เยอะหรอกลูกสบาย
ข้อเดียวเรื่องภาษาทั้งหมดคำ
เป็นการ
อา
อา
จา
จาร ร
ย์
ย์
ค
ค
รั
รั
บบ นี่เหรอ
อาจารย์ครับขอถามนิดนึงครับตอนเขียนใบสั่งยาครับคือว่าพวกผมเรียนในฟาร์มาโคให้เขียนแบบ oral stat QID อะไรเงี้ยต้องเขียนอย่างนั้นเลยไหมครับหรือว่าเอาตามในเลคเชอร์อาจารย์ที่เขียนว่า
ถูกนั่นแหละคือสิ่งที่ถูก
คือเรา
เพ
ก็
ราะ
ต้
ว่า
อง
แค่
เขียน
รู้แต่ว่าคนสมมติถ้าหมอบอกหมอจะสั่งยาให้อาจารย์
ครับ
แล้วคนที่เป็นเภสัชกรไม่สามารถจ่ายยาให้ได้ตามนั้น การรักษาก็ไม่เกิด
ครับ
ถูกไหมเพราะฉะนั้นสิ่งที่หมอทำคือหมอก็ต้องเขียน ให้เขาสามารถจ่ายยาให้คนไข้ได้
ออกก็เขียนแบบเอาของเลคเชอร์ฟาร์มาโคมา apply เต็มที่เลยนะครับแบบ QID อะไรอย่างงี้ใช่ไหมครับ ACHS
แต่สิ่งตัวอย่างที่อาจารย์ให้ก็โอเคแค่นั้นพอแล้วนะ
อ๋อโอเคครับ
ฮะถูกปะ
ครับได้ครับ